My name is Arely Quintana, and I'm studying environmental science at Broward Community College. My father's from Guatemala, and we were visiting Guatemala in 2008. And he actually contracted dengue fever from a mosquito bite, and I had to help take care of him. I don't know how I haven't gotten some weird disease when I go to Honduras and Guatemala. But yeah, my dad got it, and I had to give him shots in his butt while we were staying at my my Tío Carlos' house. And it was bad. He felt so terrible. Aedes aegypti is going to be the scientific name, and the common name is yellow fever mosquito, because yellow fever has had a longer history and is a lot more known around the world. Dengue fever has been around 1,000 years, but really become more prominent in the past 100 to 200 years. So it's caused by the Flaviviridae virus family, which in Latin, flava, it stands for yellow, because really it's more commonly the Aedes aegypti is the mosquito that transmits dengue fever, but it also transmits many other viral diseases, including Zika, including yellow fever. So and Flaviviridae also causes yellow fever, but different strains. So the strains that cause dengue fever are going to be the serotypes 1, 2, 3, and 4. The common geographic locations for the Aedes aegypti is going to be the tropical belt. Most of the countries in the tropical belt are underdeveloped and don't have a proper plumbing system for water. So water tends to collect within the house, outside of the house, in containers, in buckets, and puddles. And that's ideal for the female to lay her larvae, her eggs. And it's the female, and the female needs to feed off of human blood for the development of her egg and for her metabolism. The male Aedes aegypti doesn't feed on blood at all, just nectar, because he's not having any babies. It's always the bitches. Many people are asymptomatic to mild to severe symptoms. Mild is gonna be a fever, pain behind in your joints, muscles. Severe starts leading into shock, internal bleeding due to the hemorrhagic fever if that's present in the patient. But when you should really seek treatment is when you vomit 3 times a day. If there's blood in your vomit, if there's blood in your stool, and feeling extreme exhaustion are signs that you should seek treatment. But really, there hasn't been a real vaccine to help. So the best thing you can do is if dengue fever is prevalent in your area, wear insect repellent, reapply after a certain amount of time, wear long sleeves, try not to have any exposed skin. If you are going to be outside, have a mosquito net, and definitely you have to lower the mosquito populations around where you're gonna be. So no standing water, no containers that can collect rainwater, spread insecticide, rid your area of any mosquito larva that you can find, kill it, destroy it. Those are the best actions that you can take.